Back pain.
Yeah!
Let's go.
Low back pain is for sure my number
Let's
one.
go. I finally get one of them.
So low back pain is definitely my number one. Anywhere from throwing your back out, disc injuries, nerve-related injuries, muscle spasms. See a lot of, honestly, sitting in a desk all day, we'll see a lot of tightness in the upper back. What we call upper cross syndrome, a lot of things like that. So not just low back's probably number one, but back in general. Here's a very short list of other conditions that I personally love to treat or that we treat in general. Arthritis. Arthritis is a huge one, especially with our soft tissue therapy and with laser. So, fun case, I've worked on a couple old knee replacements. So when you gotta get your knee replaced, you gotta get it replaced. However, if you're not very good about your rehab, things get locked up. And I kid you not, I've seen people with knee replaced that cannot move their knee past here, which unfortunately, a lot of that scar tissue is deep in the knee joint, and I cannot get to that. Unfortunately, I'm not a surgeon, and I cannot do anything with drugs. So, under my scope of practice, so I have to work superficially. What I have found in some patient cases I've had is by working on the superficial soft tissue, loosening that up, we can get some increase in range of motion. A lot of times it's just that little couple millimeters to make things and functional activities a little bit better. So for instance, I had like a 63-year-old lady came in bilateral of both sides, had her knees replaced like within 10, 15 years ago, and she could not sit in the bleachers to watch her grandkids play sports. And when she did, she'd have to sit on the outside with her knee like this because she could not bend it in and because it hurt when she did bend it in. So with about 6 weeks of care, we were able to get her to be able to sit through an entire game of her grandkids in the middle section with her knee bent, which was huge to her. Did I change a ton of range of motion? Did I go from here to here? No. But did I improve the function? Yes, which is really, really cool. Other fun things. So back pain, neck pain, headaches, migraines. Like I said, a lot of that is looking not just at the chief complaint or the area they have pain, but looking elsewhere and what could be also contributing to it. And that's just part of what we do as alternative care. We look at the whole body, which is something we're looking for. Other fun stuff. Rotator cuff, shoulder injuries. Shoulders are a lot of fun. They are one of the, fun fact, most mobile joint in your body. So the more mobile it is, the more prone to injury. Who has had a shoulder injury before? Not very fun, are they? They take a long time to heal. Okay, let's see. Anything on that list you guys want me to talk about?
What about the infants?
Infants, sure. So, like my 17-day-old baby, so a lot of people don't understand why a infant or even young children need to be seen to a chiropractor. A lot of times they don't even know what pain is, or they can't talk to tell you what's going on or how they feel. A lot of times it's based off of their mood and their temperament and their behavior. So infants in particular, because birth is typically very traumatic, you'll see a lot of restrictions and tightness and problems within the nervous system, and that leads to behavioral problems such as colic, so nonstop crying. I'm talking maybe 2 to 3 hours a day that they are not crying. Sleep regressions. There are babies that go from sleeping a full night to getting only 4 to 5 hours of sleep at all day long. Constipation, that's a huge one. So especially as young children, you should go to the bathroom every time you feed. You should go in one end, out the other. If they're not having a bowel movement or pooping, peeing within a couple hours, something's locked up, something's restricted, something is not communicating to release. So that's what we work on. And like I said, it's very, very different from how we work on you guys. Yeah.
Do you see a lot of infants that come in, or?
I do. I think it's because I'm female. More than I thought I would. I know going through school, I was like, I'm sport. But in practice, I've seen quite a few kids and I enjoy it. So I think it's because I'm female. I also have had a lot of criers in my office, which I think it's female. But I'm there to help people, so I never have a problem. So you definitely, especially because my treatment sessions are about 20-ish minutes, give or take. So I get to know my patients very well. So there are some days where I kind of feel like a therapist sometimes, but it's fun. I get to know my patients very well. It's a good time. Any other ones? That's a good question. Any other thing, any list there that looks fun? Meniscus, okay. So meniscus, I'm mainly talking about like knee meniscus injuries. Anyone have one of those before? No? Okay. So our knee joints are very complicated. A lot of people have knee problems, today. When it comes to like ACL, MCL, or meniscus, those are some of the huge, or very important ligaments and cartilage within the knee. Meniscus in particular, I would say depending on the case, 50% of the time, they're treated conservatively. So meaning they're treated with physical therapy, home care, chiropractic, that kind of thing, and not surgery. When it comes to surgery, if it's that severe, a lot of times nowadays they actually just take the meniscus out, which unfortunately, well fortunately, it decreases the pain because you don't have that tear anymore. However, you do have some long-term problems in 15 to 20 years. So if we can avoid that, that's what we go for. So in my office, we do a lot of laser therapy. I'll do some soft tissue work above and below where the meniscus is damaged. I will do a lot of home care or even in-office care. So that's kind of what I do for meniscus. Does that answer your question? Anybody else?
What is
ITB is iliotibial band. Who has had iliotibial band problems? Anybody? Yeah, I'm right there with you. They're not fun. So IT band or ITB is a tendinous band that runs from here all the way to your knee. So it's a very common injury in runners, or it's also common because you sit all day long and then you try to be active. So
I was gonna say, a lot of these kids probably have very bad IT bands.
oh yes, because it's sitting.
And you see a lot of kids when they're walking like this, that IT band is pulling their.
Just pulling it crazy, crossing your legs. That, I was one of those. I try to get better at it, but you know, sometimes you can as a female. But yeah, so your IT band is a tendinous band that comes along here, and like Trustee said, it gets very tight. When you're sitting. When that gets tight, it not only pulls here over your hip, so sometimes we can get some inflammation and pain in the hip, but a lot of times we also get pain by the knee, because it's chronically pulling right at that insertion point in your knee. So some people, majority of the time, a lot of runners will come in with knee pain. They're like, well, why are you working on my hip? Well, it's stemming from the muscles of the AT band are in the hip because we sit. Yeah.
Is it also commonly referred to as a concussion?
Not quite. I think you're thinking of a hamstring muscle. So hamstrings, there is not just one hamstring muscle, you actually have three. And one of them is called semitendinosus, and it's mainly because it has a huge, long band of tendon at the very end. Typically, it varies from person to person because we're all different, but usually at least about this long on the back of the leg. So I think that's what you're thinking of. I haven't heard of a T-band called a guitar string. Yeah.
I used to go to trigger point therapy as
Yeah.
well.
Okay.
For my typical
toes and she would work on my T-bands and I used to cry because it hurt so
It
bad.
hurt so bad, because a lot of times when you're looking at your feet or even your hips, it comes from joints above and below. So even though you're walking on your tiptoes, like your therapist had, it came from the hips or it was affecting your hips. One or the other, it's hard to say. But trigger point theory, that's really good. Dry needling, that's a huge trigger point therapy nowadays as well. Great questions, you guys. Any other ones?
Carpal tunnel?
Carpal tunnel. Who knows what carpal tunnel is? Anybody? Kinda-ish. So, yeah, it's in your wrist. So, females, we tend to get it more often than males, but basically it is when the nerves are affected in not only your wrist, but it actually can be worked up all the way into your neck. But their nerves are affected, which causes numbness, tingling, burning, and pain in our hands. A lot of times it's from typing all day long, just with that wrist bend. Sometimes it's sleeping wrong, sometimes pregnant females with the accumulation of fluid, that presses on nerves, and sometimes for some particular reason, always leads to our hands and feet. But yeah, so for that, it's a lot of soft tissue work. So for carpal tunnel in particular, as a chiropractor, and what I do, I have to distinguish where is it coming from. Is it the wrist, is it the elbow, or is it the neck? Because the nerves that are causing the pain, they don't just start here, they start here. So I have to distinguish where it's coming from, and I have to treat the area accordingly. Majority of the time, I do have to work all three, but sometimes I can say, oh, it's just the wrist, I can save some time. So, great question. Any other questions? Yeah.
Okay, so this isn't about like the conditions or anything, but
Yeah.
like when you do like when you're like going to a chiropractor, is it like a long-term thing? Like do you have to constantly get like readjusted and like have to go through that like for like years in order to
I love that you asked that question. So, in the past, and granted we are a fairly new profession, but in the past, it's been a misnomer that once you go to a chiropractor, you gotta keep going. It's like going to dentist, you gotta go all the time to be routine. That's not my philosophy. Some chiropractors do recommend that you see them 3 times a week, every month for the rest of your lives. I don't think that's necessary. I truly believe, and I want to teach my patients how they can protect themselves. And I want to get you better as fast as you can. I want to, if you're having neck pain, back pain, let's teach you posture. Let's teach you stretches. Let's do things that you can do on your own to help you live a healthier lifestyle. Does that mean I will never see you? No, because getting adjusted, getting restored mobility, are you going to have better treatment, better outcomes? Yes. Is it necessary if you do what you should be doing? No. So my goal is, especially, I relatively see patients, if they come in with a case, I will see them anywhere from typically 4, maybe 6 to 20 visits most, and then I typically release them and then I'm there when they need me. Some patients do opt in for maintenance care, is what we call seeing a chiropractor more regularly, but that's typically just to help that a lot of times like migraines. Headaches is a classic one. So instead of taking classic migraine medications or having injections, they come see me once a month and it keeps migraines away, which is fantastic. So, does that answer your question? Cool.
What is your opinion on cracking your hip?
Cracking your bone. Another great question. So, it depends what you're doing. So I have seen people go and try to whip their back around trying to crack it. I've seen people try to whip their neck around. I hate that. There's so much nervous and vascular tissue in there that you can be affecting the wrong joints, affecting the vascular tissues, your arteries, your veins, that kind of thing when you do that. However, joints are meant to move. If you hear a pop or a crack and it doesn't hurt, it's okay. So when I take a shower in the morning, I'll go and do a nice head roll like this. I will get some pops and cracks. Am I taking myself whipping my head around? No. But am I keeping mobility, stretching out a little bit? Yes, which is okay. A lot of times because we sit so much in our society, in school, at work. A lot of times I will recommend even people using a foam roller along their back, and a lot of people will get popping, cracking, or joint popping with that too. Which, if it's along your mid-back, I'm not as concerned, especially when you're on the foam roller, because we're getting that extension that our body needs. Because we are sitting like this all day long, which is not good. So anytime we can get that extension in there is really good. Does that answer your question? Any other questions?
What are you seeing with cell phones?
Cell phones, TextNet, that is an actual thing. TextNet, yes, look it up, it is a thing. So, cell phones, everybody is down like this, and within our spine, specifically our neck, we have a concave curvature, so it kind of looks like this, right? However, the more we do this, the more that curve becomes straight and not concave, which is called TextNet. When it's straighter, we have more gravity, because gravity, our head moves forward, puts more pressure on our back, more pressure on our neck. So not only when you get older, you're gonna have more degeneration, you're gonna have a big humpback, which no one wants. I know everyone sees the grandma with humpback, right? Huh? Yeah, which some people, they can't avoid it because it's a condition, but majority of the time it's because our head slowly creeps forward, pushing more pressure on there. So unfortunately, we've all grown up with cell phones. I mean, how old are you guys when you got phones? 8. 8. 8. Okay, 15. That's more like I was. Krzyzewski, how old were you when you got a cell phone?
I got mine somewhere.
I don't know.
30 something?
Almost
So, yeah, 8, 15, somewhere in the teens-ish compared to 30. So that means we have an extra 15 years on a cell phone. Yeah, 9. It's crazy how young people are.
Oh, there's a 6-year-old that had one. Better phone than I did.
Yeah. So, so back to where I was kind of going with that. Our parents and they have, but we have about 15 years or more, and our kids are probably going to have less than that of experience on the cell phone. So that chronic use of bending our neck is only going to hurt ourselves between pain, dysfunction, and even physical, getting that humpback, because scar tissue is bone they build. My biggest recommendation, I tell patients all the time, bring it up. Get a forearm workout, get a shoulder workout in. Instead of here, hiding it from your teacher, trying to text in class, bring it up.
Look at them all.
I got it.
Oh, you should be using it in class anyway. But bring it up. You're sitting at home, you're on an iPad, you're on your phone. Sit it up here. You're keeping the head nice and neutral. We're not working on the upper back or the neck. You're actually using your forearms, which not a bad idea anyway. So bring it up. That helps a lot with cell phone usage with our neck and upper back. Great question. Yeah.
For your first time, are there like a lot of, like the second schools that you have to go for 3 years?
There's probably 15 in the U.S., so there's not as many as like medical schools or DO schools, but there's enough around. So I chose St. Louis, Logan University, mainly because it was a more sports-oriented, very evidence-based program. There's ones the closest one would be Northwestern in Minneapolis. There's one in Chicago, one in Iowa, then I also toured a school down in Florida because I wanted to escape the winter, but I'm back, so there's that. Yeah.
So, do you just go to college for like 4 years and then you have 3 years of like chiropractor?
Yeah. So it's your undergrad degree, which 4 years or so for a bachelor's, and then your chiropractic degree, which is a doctorate in chiropractic, which is, my school was 10 trimesters, so it was just under 3.5 years. Sometimes it's 12 quarters, so, or 13 quarters, something like that. So it depends on the school you go to, but it typically takes 3.5 to 4 years.
For you, like, self-employed, or you employed,
I'm employed, so I'm an associate doc at the office. There's me and another doc that works there. 60% or so of our profession are self-employed though. Great question. Anybody else? Okay, we're almost out of time, so before we finish, I had one last fun, this is a good friend of mine / patient. So she, last year was out skiing and she was trying to do a 180 turn and went back and pulled her hamstring. I saw her about 3 days first after the incident, came in limping, little bit of bruising along the back of the leg, not a ton though, very small. But she couldn't walk. She was in a ton of pain. She was limping. She was very tight. Couldn't even barely go to work. Like she had to hobble to work. But wasn't all bruising. Saw her 6 days later, and that was her leg.
Is that LC?
It is. So she had a grade 3 adductor magnus, which is a hamstring groin muscle strain. Yes, talk about painful. However, to not her doctor's orders, I have her back skiing in about 2 weeks. And within 26 days, she was completely symptom-free, which is pretty big. She did have some strengthening stuff that we had to do afterwards, but this is kind of a good progression of what we did. For her, we did a lot of laser therapy, did a lot of soft tissue work. We did K-tape, which for this specific injury helps to lift the skin, help to remove the blood, let the edema and the swelling go down. So bruising patterns are really fun to do. It's like art. I love it. Yeah, so that's kind of a fun progression. You did have a question?
Well, I was just gonna ask like what the actual purpose of like using the tape is, like what does it actually mean?
Yeah, so it's to help lift the skin, to help separate the tissues, so it allows blood to move out and out of the way, because a lot of times this glue, that's your old blood, it's not doing anything, there's no oxygen, no nutrients in there, so it's not helping matters. So we like to lift the skin, get the blood flow pumping, get it moving, getting the swelling down, because her leg was, it's hard to tell compared to her other leg, but you can even tell from here to here, it's just, the swelling, how much that's kind of gone down. So that's kind of the purpose of the tape in that sense. But yeah. Huh? Cupping?
Cupping.
Yeah, cupping. So cupping is kind of the same, along the same lines as tape. It's used as a tissue to decompress the tissue. So it uses the negative pressure within the cup to separate the tissue. For that instance, the darker the bruise in a cup means the more blood flow that tissue needed, or the more oxygen that tissue needed. So that was a little bit different, but it's the same line. It's to help separate the tissues to bring more blood flow in. So Michael Phelps is known for that because, unfortunately, as sticky as this tape is, it's not going to hold up in a pool compared